minutes past the hour, we will be starting this webinar in a few minutes. Good afternoon. Thank you for joining today's School Safety and Collaboration, Building a Behavioral Health and Justice Response webinar. My name is Felicia Lopez-Wright, and I am a Policy Analyst at the Council of State Governments Justice Center. I will be moderating today's webinar, which is hosted by the U.S. Department of Justice, Bureau of Justice Assistance, and presented by Policy Research Associates, National Center for Youth Opportunity and Justice. To give you an overview of today's webinar, first, we will do introductions of our panelists and provide an overview of BJA, the Justice and Mental Health Collaboration Program, JMHCP, and the Council of State Governments Justice Center. Next, we will hear from Policy Research Associates regarding their work, school safety data and policy change, the school responder model, behavioral health and justice cross-systems collaboration, and strategies for reducing school violence. We will also hear from Schenectady, New York School District regarding their school-based diversion initiative. Toward the end of the webinar, we'll also have time for questions and answers. Anytime during the webinar, you can ask a question by typing it into the QA panel on the bottom right-hand portion of your screen. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please call WebEx technical support at 1-866-229-3239. Please understand that there are some technical issues that you may not be able to resolve. We are recording the webinar, and we will email it to those who registered by the end of next week. For introductions, David Adams has served as a Senior Policy Advisor for Law Enforcement for the Bureau of Justice Assistance for the past 15 years, where his portfolio is mainly focused on the Student, Teachers, and Officers Preventing School Violence Program and the Center for Task Force Training Program. In the past, his policy portfolio has also included the National Center for Campus Safety, a resource for institutions of higher education, human trafficking, and the Gang Resistance and Education Training Program. Dr. Crystal Brando is a Senior Project Associate with the National Center for Youth Opportunity and Justice and Policy Research Associates. She serves as the Project Director, Program Implementation Team Lead for the National Institute of Justice Comprehensive School Safety Initiative. Crystal has been working in the fields of behavioral and community health for over a decade. She is also a founding member of the Society for Health Communication and an active member of the American Public Health Association Mental Health Section. Timothy Ferrara is the Deputy Director of the County of Schenectady Department of Probation in Schenectady, New York. Tim oversees Juvenile Justice Services, which is a partnership between the Department of Probation and the Schenectady County Office of Children and Family Services, OCFS, who provides support and supervision through targeted responses with juvenile justice-involved youth and families. The staff consists of 20 full-time probation officers and 9 full-time OCFS employees who provide pre-diversion services, intake services, investigations, supervision, and community-based interventions to at-risk youth, families, and victims. Avery Irons is a Senior Project Associate with the National Center for Youth Opportunity and Justice and the Policy Research Associates. She provides support for the NIJ School Safety Program and directs the NCYOJ's training development and coordination. In previous roles, Avery has led juvenile justice policy advocacy efforts for Children's Defense Fund New York and the Correctional Association of New York. She has also provided training and technical assistance to systems implementing best practices for serving LGBTQ children and youth in child welfare, juvenile justice, and mental health systems. Andrea Tote Freeman is the District Director of Pupil Personnel Services at the Schenectady City School District in Schenectady, New York. Schenectady Schools is an urban public school district which serves 10,000 students. The district is filled with rich culture and diversity, with students speaking more than 30 different languages. Andrea has been with Schenectady Schools for 10 years, and prior to the role of PPS Director, she served as a district administrator in the area of special education, as well as a school counselor. Allison Upton provides leadership to the JMHCP Category 3 grant program. She oversees and provides technical assistance to grantees and supports policy development and projects specializing in the intersection of criminal justice and behavioral health issues. Thank you everyone for joining the webinar. And now I will turn things over to David Adams to talk more about the Bureau of Justice Assistance, or BJA.
Good afternoon, everyone. Thank you for joining today's webinar. My name is David Adams, and I'm a Senior Policy Advisor with the Bureau of Justice Assistance. BJA provides grant funding across the criminal justice continuum for policy development and for support to local and state organizations, as well as nonprofits that are doing work in the area of criminal justice. This is a very timely webinar because I also manage one of the programs that are related to school safety, the Stop School Violence program. One of the components of that program is mental health training for school staff as well as students to be able to recognize individuals who may be in crisis and may possibly commit violence against themselves or others at school. BJA currently has a solicitation that's open to the field between now and June the 9th for applications to implement programs at K through 12 schools that would encompass a number of areas, including threat assessment, but also training. You can find about information about all of the BJA grants that are currently open at BJA's website, bja.gov, and simply click the funding tab at the top of the page, and all of the open solicitations that we have at this time are listed by closing date order. I apologize I won't be on for the rest of the webinar, but you can feel free to ask any questions, and those will be forwarded to me, and I'll be happy to respond to those if the folks that are presenting today cannot answer those for you. Thank you.
Thanks, David. The goal of the JMHCP grant program is to develop collaboration across the criminal justice and behavioral health systems from law enforcement, pretrials, courts, jails, and community supervision. To learn how to have successful partnerships that increase efficiencies and improve public safety and outcomes for people with mental illnesses or co-occurring mental illness and substance use disorders in the justice system. I'm now going to give some background on the Council of State Governments Justice Center. The Justice Center is a national, nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. As an organization, we focus on a range of areas within the justice system. We pride ourselves in having a deep understanding of the experiences of people at the front line of the justice system and our ability to gather people from both sides of the aisle and across the country to foster collaboration. We promote smart and effective policy and practice changes through in-depth data analysis, on-the-ground training, direct assistance to state and local agencies, and dissemination of best practices and research. And now I will turn it over to Dr. Crystal Brando and Avery Irons from PRA to provide an overview of their work at the NCYOJ, discuss school safety data and policy change, introduce the school responder model, and how behavioral health and justice systems can collaborate to reduce school violence.
Thank you so much for that introduction and for setting the tone for today's discussion. And thank you to everyone for joining us. As it's been mentioned a couple of times, Avery and I are with the National Center for Youth Opportunity and Justice. Our work aims to improve life opportunities for youth through systems and practice improvement initiatives. Since 2001, we've translated research into policy and practice to effect change that produces more efficient and effective systems, generates better outcomes for vulnerable young people, and maintains safety for youth and their families, youth-serving professionals, and communities as a whole. You may have heard of us before. We were previously known as the National Center for Mental Health and Juvenile Justice, or NCMHCP, and now known as the National Center for Youth Opportunity and Justice. So the work that we do really aims to support communities and build capacity to better serve youth and their families. We're supported with funding from foundations, federal and state agencies, as well as national organizations. And having both this public and private support enables us to engage in a wide variety of projects that really promote systems change and improve outcomes for youth. So you'll hear a little bit about just one of the initiatives that we're working on in today's discussion related to school responder model. And all of the work that we do, again, is really designed to communicate with policymakers and practitioners and affect this change for youth and their families to create some more positive outcomes. So before we dive into today's discussion, I'm going to hand it over to Avery. She can introduce herself. You could hear her voice, and I would like to engage you all a little bit. So I'll hand it over to Avery.
Thank you, Crystal. Hi, everyone. This is Avery Irons, working with Crystal at NCYOJ, the National Center for Youth Opportunity and Justice. Thank you so much for joining us. And we wanted to really have this conversation be interactive in some way. And so what we want to start off with is just when you hear the words in 2020, today's world, school safety, what does that mean to you? So if in the chat box on the bottom right hand of your screen, if you could just type a few words, a few thoughts of what first comes to mind for you when I say to you, school safety, and what does that mean today? So I'll give folks a few seconds to type in some stuff and we can see where the conversation is. Okay, so our first thoughts, prevention, school resource officers. children, trauma-induced care programs we have. Someone says no fear. So I'm so glad we're getting a wide range of thoughts, because I think it is really a diverse conversation. So folks, I'll wait a few more seconds for a few more folks to say what they're thinking. So we have another school resource officers and lockdown drills, emotionally safe and physically safe, kids being able to be in an environment free of fear and free of bullying. Excellent. And keeping everyone in the building at harm's way. Thank you. So I'll keep my eye on these as they come in when I take the slides back over. So please keep typing your thoughts so I can get it. So I just want us to kind of hold this, and there's some themes we're definitely seeing, like the role of school resource officers, this idea of freedom of fear for their students. And I think we're getting into some programmatic discussions too around trauma and how to respond to students' needs. So I'll keep an eye on that, and so please keep typing stuff. And in the meantime, I'm going to hand it back to Crystal.
Thank you so much. Like Avery mentioned, some of the threads that we're seeing come into the chat will be part of today's discussion, and it's great to just take a pulse and see what people think of when they think about school safety, which is a key piece of today's discussion. So school safety applies to schools and school-related activities, and it's about environments where students are safe from violence, bullying, harassment, and substance use. And we know that school safety is linked to improved outcomes for both students and the schools, meaning the faculty and staff in the schools, and overall it's associated with school climate, which is the quality and character of a school. So we'll talk more about what this means throughout today's discussion. When considering school safety, it's important to point out some of the stats. So we'll go through some of the data here. In the 2017 to 2018 school year, 71% of schools across the United States reported at least one violent incident. And violent incidents include things such as a physical attack or a fight with or without a weapon, threat of physical attack, sexual assault, rape, robbery. So 71% of schools did report at least one of these incidents, and another 65% reported at least one nonviolent incident. So nonviolent incidents will include things like possession of a firearm, illegal use of drugs or alcohol, inappropriate distribution, possession or use of prescription drugs, possession of a knife or a sharp object. These are the nonviolent incidents also prevalent in schools. And in a little while, Avery is going to talk a little bit more about some of these data. Something that's important to point out, however, is that we know from the media, there's a perception of school shootings being very prominent. And the reality is that school shootings are actually rare and school crime rates are decreasing. So even though what you see on the screen may seem alarming, the high profile and media reporting of school shootings impacts our perceptions of the frequency. So again, these are data related to at least one violent or nonviolent incident in schools. And some of these things do include activities like bullying or drug use and so on. So hopefully we can help paint a picture for people that, school shootings and severe school violence, while they do indeed happen, school safety is a much bigger conversation than just those items. And we know that schools are taking action and they have a number of mechanisms in place to promote school safety. So again, if we look at the 2017 to 2018 school year, almost half of traditional public schools had at least one school resource officer on campus at least once a week. And school resource officer came up in the chat box as something that someone thinks about when thinking of school safety. And schools also have a variety of written crisis plans for a number of school safety concerns, whether that's a natural disaster, bomb threat, active shooter, and so on. So schools are indeed doing what they can to create these safe environments and have these different strategies in place. And we can see that these strategies in place are increasing over time. So what you'll see on the screen right now, and hopefully can read the fine print here, that there have been increases in a number of measures used to keep schools safe in public schools. So anything from controlled building access during school hours, the prevalence of this has increased. The data that you see here is from 1999 to 2000, compared with 2015 to 2016. Schools are requiring students to wear uniforms with more frequency. There are telephones in most classrooms as a safety measure, increased camera use to monitor schools, and so on. So this is just to provide a snapshot of how schools are transforming over time to implement a variety of measures to support safety of the students in the school more broadly. In addition to these traditional measures, there are some alternative strategies that schools are employing, and we're going to talk a little bit about some of these when we talk about a school responder model, the school responder model shortly. Alternative strategies include things like using restorative practices and implementing restorative circles, and administering mental health assessments. Just over half of schools are administering mental health assessments to students, and then close to 40% are then providing mental health treatment to students who may flag on a screening tool as being able to benefit from some sort of mental health support. So these are some alternative strategies that are becoming more prevalent, and we'll talk about these in a bit more detail in just a moment. I'll pause there and ask, Avery, do you have anything that you'd like to add on some of the data that's been presented thus far?
I don't. That was great. Thank you.
All right. Thank you. So I mentioned the school responder model, and we'll dive into this a little bit. So one of the ways as a nation that we're seeking to increase school safety and improve school safety is through the Comprehensive School Safety Initiative. This is a National Institute of Justice initiative, and it's just one mechanism for exploring opportunities to improve school safety. So again, although the data indicate that school crime rates have declined nationwide since the 1990s, and student victimization has also declined, there is the perception that schools are dangerous places. So regardless of the media coverage creating the perception that schools are more violent than they may actually be, there is the reality that educators do face these daily challenges to school safety, and these are things that may not be as commonly perceived as safety concerns, like misconduct, harassment, bullying. All of these things go into shaping the school climate, school culture, and having an impact on whether or not students feel safe at school, and teachers, educators, and other members of the school staff feel safe at school. So the Comprehensive School Safety Initiative from the National Institute of Justice funds a variety of programs, practices, and research efforts to explore what can create safe schools. They're looking at the root causes of the threats to school safety, and there's been $75 million spent per year for this initiative between fiscal years 2014 and 2017. So this is just one of a number of efforts in place to try to really understand school safety and create some additional mechanisms for improving school safety. So this is an award that the National Center for Youth Opportunity and Justice has received. It's an investment in developing knowledge about the root causes of school violence, developing strategies for increasing school safety, and evaluating school safety strategies through pilot programs. So what we have here, and I know, sorry, I'm going through those slides fast, so I'm not reading from them. This is an overview of the actual school safety initiative. So what we'll do briefly is talk about some different types of violence. I'm going to hand it over to Avery to do that. And then we're going to come back to the NIJ Comprehensive School Safety Initiative and dive in to the efforts that NCYOJ is engaged in through our funding, through this mechanism, to create safer schools and provide services and supports to students with behavioral health conditions, as well as students that may have substance use disorders or a history of trauma exposure. And we're able to accomplish this through this NIJ Comprehensive School Safety Initiative, or CSSI. Before talking about that, however, it's important to further understand these different types of violence. Like we talked about, it's not just what we often think of as physical violence. There are different pieces of the puzzle here that is helpful to understand for creating strategies for violence prevention and safe schools. So I'm going to pass it over to Avery to lead us in that discussion.
Excellent. Thank you, Crystal. So I wanted to go back to what's popped up in the chat while you were talking and just highlight some of the themes that we saw. And so multiple people were coming back to physical and emotional safety and preventing trauma and injuries. A lot of folks talked about partnership between schools and communities, and a lot of folks were talking about balancing kind of zero tolerance policies that have been enacted with behavioral and educational needs and supports and family needs assessment, and how schools and communities can be responsive to, those behavioral health needs, as well as, food scarcity and housing insecurity. And I appreciated one commenter's question about needing to think about why students are feeling unsafe. And so as we think about these types of violence and those things that, get a lot of media attention, like students carrying weapons, why is it that students are feeling unsafe in the school environment, and how we can be aware of that and make decisions that can increase safety as well as increase the sense of safety. So I want to talk about school violence, and as we were planning this discussion, one of the things we were thinking about was what are the types of school violence? Depending upon, maybe generation and location, we might think of just physical school violence, and that's a lot of what's, in the news: fighting, assaults with or without weapons, gang violence. Those are really common in the discussion of school violence. But there is this whole other category of non-physical school violence that we talk about in some ways, like bullying and cyberbullying. But there's an interplay between the physical and non-physical. And if we're going to think about the scope of school violence, we want to recognize the different components of it, and we'll talk a little bit about prevalence in a moment. And so as we think about non-physical, I just want to highlight, because of the kind of pervasiveness of the internet and social media, these types of violence that we are calling cyberbullying, verbal bullying, threats, intimidation, isolation, are very difficult for young people to disengage from, and are, emotional and mental distressors as well, but they don't stop at the school property line, and they don't stop at the end of the day. And so it can be very difficult for young people to disengage, and also very difficult for adults to track and to respond effectively. So as we think about types of violence, we're going to look at rates of prevalence. And so this information that I'm going to talk about on this slide is pulled from a really helpful resource called the Indicators of School Crime and Safety, which is a publication put together by multiple agencies such as the National Center for Education Statistics, the U.S. Department of Education, Bureau of Justice Statistics, Department of Justice. So it's an annual report on school safety. So this is the 2018 version, which is actually their 21st annual report. And it looks at data from 2015 to 2017. But because this is their 21st annual report, they're in some instances able to compare rates of school safety and crime from as far back as 2001 to rates today. So I think the first place I want to start in this discussion is just, as Crystal said earlier, across the board we're seeing a decrease in school violence incidents in all of the categories, so physical, non-physical, weapons, drugs, all these things. And so we want to hold on to that acknowledgement that these rates are dropping. And so when I was looking at the indicators, there's over a dozen indicators, and they look at hundreds of data points. So I just wanted to pick out data points that are common to the discussion around school violence. And so I selected bullying, physical fighting, and carrying a weapon. And so just wanting to think about prevalence. And so for students who reported being bullied as part of this national survey, in 2017, those bullied on school property were 19% of students. And cyberbullying was reported by just under 15% of students. There is not a 2001 comparison for that, but there is a 2001 comparison for physical fighting. So in 2017, 24%, just under a quarter of students reported having a physical fight anywhere. So not just at school, but anywhere in their lives. And that number is actually down 9% from 33% in 2001. For physical fighting on school property, that number in 2017 was 9%, which is down from 13% in 2001. And when we look at carried a weapon on school property in the last 30 days, that number is 4%. And for students who carried a weapon anywhere, that number is 16%. And if you look at other indicators of school violence, such as students reporting gang activity on their school campuses, that number is also down. It was 20% in 2001, and it's down to 9% in 2017. Students reported being threatened or injured with a weapon at school, on school property during the past 12 months was down from 9% in 2001 to 6% in 2017. So across the board in all the categories, we are seeing a decrease in students experiencing violent incidents. We did want to take a moment in the conversation to see how this played out for particularly vulnerable populations of students. So while there may be significant declines in bullying or violence incidents in general, there are still populations that may be experiencing disproportionate amounts of bullying and violence. So if we look at the experiences of youth who are identifying as lesbian, gay, bisexual questioning versus their heterosexual counterparts, over a quarter, 27% of students reported experiencing cyberbullying. 20% of questioning students, so that would be students who aren't sure of their sexual orientation at this point in their life, reported being bullied versus 13% of their heterosexual counterparts. We also wanted to look at the experiences of students with disabilities. Versus students without disabilities. So this is an evolving conversation in the field, and I think it's going in really interesting directions because there's this assumption that, especially if you're talking about emotional and behavioral disorders, that, these are the students who are perpetrating victimizations and bullying without necessarily taking into account that there's this kind of bullying dynamic. And while some students with emotional and behavior disorders may be perpetrating bullying or violence, they're also being overrepresented as victims in the bullying dynamic. So if we look at students with emotional and behavior disorders, 35.3% report experiencing high levels of bullying victimization, 33.9% of students with autism, and 24.3% of students with intellectual disabilities are reporting high levels of bullying victimization. And so as we continue to walk through this conversation, we don't want to shy away from the really difficult parts of it around violent victimization. And so we looked at some stats on violent victimization and serious violent victimization. So all violent victimization includes a serious component plus simple assault. In 2017, there were roughly 21 victimizations per 1,000 students at school. When students were away from school, that number dropped down to 12 violent victimizations per 1,000 students. Serious violent victimizations includes rape, sexual assault, robbery, and aggravated assault. And in 2017, there were, at school, that number was roughly 4 students per 1,000 students, and away from school, that number was roughly 6 students per 1,000 students experiencing serious violent victimization. And then we, of course, need to talk about school shooting incidents, which I think played a lot in some of the tone of the comments that we saw in the chat box. There's this question of fear and why do students feel unsafe? And so if we, look at this era in American history, we are talking a lot about active shooting incidents that happen in school. And so, the FBI's data shows that between 2001 and 2018, there were 42 active shooting incidents. So since it starts at 2001, it doesn't include the Columbine shooting that happened in 1999. And so if we zoom a little closer to our current time period, looking at 2018, when we have the last complete FBI data at the time that we were writing this, there were in 2018 24 shootings in schools that resulted with injuries or deaths. Interestingly, these shootings occurred if we look at the breakdown of them, 2 occurred at elementary schools, 4 occurred at middle schools, 18 occurred at high schools. 13 of the incidents happened during school hours and on school property, and 10% of the schools had police officers or SROs assigned to the school. In 2018, there were 35 people killed in school shooting incidents and 79 people injured. So these statistics, and if we look over the range of, the past 20 years, they've done a lot to shape our policy conversations at the state and local level on school safety, on school violence. So in February, I want to highlight for you something that Child Trends put out, which is a really helpful tool on understanding the policy changes at the state level that were enacted since 1999, when the Columbine shooting occurred, to 2019. And so as we see, on the chart, there's been consistently, school personnel training, school building security, an increase in threat assessment, and an increase in active shooter preparedness. But as we look at some of the blue and green colors, we also see an increased attention to building cultures of connectedness in schools, responding to cyberbullying, especially if we look from that 2006 to 2012 area, those years when we started to really understand the pervasiveness of cyberbullying. We started to see student suicides based on experiences of cyberbullying. And then you also see over the years an increasing attention to policies around mental health of students. And so some of the other things that Child Trends noted in this kind of visual report that they put out were that 40 states now encourage or require schools to maintain safe school climates and school climate provisions, and 13 to 37 require character development or social and emotional learning. And so I think these changes in that kind of blue-green area that you're seeing are really coming about as part of conversations about what's working and what hasn't worked over the past 20 years. And so if we think about policy transformation in 1999, after Columbine happened, there was a very quick and very stark move towards zero-tolerance policies and use of exclusionary discipline for violent infractions as people tried to figure out how to grapple with and prevent these things from ever happening again. But, with any type of policy shift and change, you eventually get the lessons learned and what are those unintended or unexpected outcomes that came out of those zero tolerance policy shifts. And so what we saw was over the years, disproportionate use of exclusionary discipline and school arrests for African American and Latinx students. So you'll see students with disabilities were twice as likely to be suspended as students without. 25% of students in schools have IEPs. African American boys were 55% more likely to be suspended than their white peers for the same offense. And so I won't run through kind of everything that came that's come out of this thing, but there are student support innovations that have been developed to try to support students in schools so that they can stay in class and not experience kind of those adverse life outcomes that happen when a young person does have contact with the juvenile justice system. So there's, some evidence-based programs listed, and there's a school-focused area, and then there's also community-focused topics like crisis intervention responses. So are your police in your local community using crisis intervention teams? Have they been trained on crisis intervention teams for youth and systems of care and wraparound services that offer coordinated care to families of students? So we'll talk a little bit about this as we continue and we see what the SRM can do and what Schenectady has done. So with that, I will turn it back over to Crystal, either for comment stat on this or to move us on to the next section.
Thank you so much, Avery. And I really appreciate Avery's mentioning of the different resources that were used to gather the information for the slides. And a resource like Child Trends is a place where you all on this webinar who are interested in learning more about this topic can go to get some additional information. So towards the end of today's presentation, we do have some resources listed out on the slides as well. But Avery, I appreciate your sharing where these data come from, this information comes from, so that the viewers and listeners can also go and learn more on their own time. So moving into some discussion here about the school responder model. We mentioned this a couple of times and kind of segueing from Avery's talk just now on transforming policy change. Policy change is inherent to a school responder model. So a school responder model is just one of the interventions that NCYOJ is implementing as part of our NIJ Comprehensive School Safety Initiative Award. School responder models, even though we're doing this work right now through NIJ, there's a history here. School responder models were initially developed with cross-systems collaboration with a number of states through the Mental Health Juvenile Justice Action Network. In 2007 to 2011, this was Models for Change funded by the MacArthur Foundation. And it started off with 8 states that were doing this work. So this is going back over a decade ago that the school responder model was conceptualized as part of this action network and with these states to look at school safety, particularly for students with behavioral health needs, looking at how to keep these students in school with the supports that they need and out of the juvenile justice system. So the Policy Academy Action Network was tasked with developing and piloting school-based diversion initiatives for youth with these behavioral health needs to not only keep the students out of the system as much as possible, but to train adults on working with students with behavioral health conditions, as well as to focus on family engagement. So if you're not familiar with a school responder model, we'll spend some time talking about that here and talk about how this relates to school safety. So what you'll see on the slide here is a traditional school to justice pathway. If there's a school infraction, it's not uncommon traditionally for a student to maybe be arrested on spot at the school by law enforcement or to receive an out-of-school suspension. We know that students who receive an out-of-school suspension are more likely than their peers to be arrested in the following year, which then leads to entry into the juvenile justice system. So the traditional school justice pathway, regardless of whether it's directly through arrest or arrest that follows an out-of-school suspension, there is this entry into the juvenile justice system that's prevalent in this traditional pathway. What a school responder model does is offers an alternative to this school to justice pathway and offers a behavioral health response for schools and communities, and we'll talk more about how it's not just schools responsible for this. So in a school responder model, when there's a school infraction by a student, there are a number of options here as well, one of which may be that a responder completes a behavioral health screening to identify whether or not this student has underlying mental health, substance use, or trauma history needs that would justify a clinical assessment for a student who has been flagged on that screening, and then work with that student and their family to develop and the provider to develop a treatment plan and get connected to community-based, culturally appropriate, relevant behavioral health services. Another possibility for the school responder model approach is after a school infraction, there is indeed school discipline and accountability based on a graduated response or restorative justice model. So in both of these, as you can see, a student is not suspended for this school infraction. They're kept in school and either engaged in a restorative approach and or through a screening mechanism. The screening is really inherent to school responder models. And so most schools that we're working with would do both of these options, or depending on capacity of the school, maybe they haven't fully implemented restorative approaches, but they will indeed engage in the screening using a validated screening tool that's appropriate for the demographics that they're serving in the school. The reason why we focus on behavioral health, all of the work at Policy Research Associates focuses on systems that intersect with behavioral health conditions. And what's really important for youth is if we look at the number of youth involved with the juvenile justice system who have behavioral health conditions, we see that a vast majority of these youth may have a mental health condition, a substance use disorder, or have had exposure to traumatic events. So the estimate is anywhere between 65 to 70% of youth involved in the justice system have a mental health condition, 46% have a substance use disorder, and 90% of these youth involved in the juvenile justice system have had exposure to traumatic events. And so if we look at suspension or expulsion from school as vehicles through which students are brought into the justice system, we can see that clearly a majority of students who are indeed suspended or expelled may have any of these three experiences on the screen and would therefore benefit more from supportive systems, treatment, and a holistic approach rather than entry into the juvenile justice system. And Avery talked a little bit about disproportionality, and we see that in school discipline. Black students account for just over 15% of public school students, but account for 39% of the student suspensions. And this is from the U.S. Government Accountability Office. This is data that was published in 2018. And we also, going back to LGBTQ youth were mentioned on some of Avery's slides as well, these students experience greater levels of school discipline and have greater involvement in the juvenile justice system than their peers who do not identify as members of the LGBTQ community. So for students of color, LGBTQ students, they're more likely to be suspended or expelled than their peers, and we know that students who are suspended or expelled are 3 times more likely to be in contact with the juvenile justice system. So the goal of a school responder model is really to keep these students in school and with the behavioral health services and supports that they need. There are 4 core components to a school responder model, and we're going to spend a lot of time talking about the cross-systems collaborative team. As mentioned at the outset of this webinar, that's one of the goals here, talking about school safety and collaboration. So the 4 components are forming this cross-systems collaborative team, engaging families and youth in this model, implementing a behavioral health response, again, engaging in that screening of students to identify those who may have an underlying behavioral health condition and benefit from treatment and support, and creating formal structures. And we'll talk more about these things. In addition to these core components, there are guiding principles that we found doing this work that really support the most successful school responder models being implemented that we're familiar with. So in addition to those core components that are absolutely necessary to having a school responder model, without cross-systems collaboration, family and youth involvement and engagement, behavioral health response, and formal policies and structures, there is no school responder model. So those core components are inherent to this work. These guiding principles aren't necessarily required for implementing the school responder model, but the most successful efforts will include one or more of these things, which are becoming more and more commonplace in school environments in general, which would be trauma-informed practices, restorative practices, a focus on wellness and self-care for educators. As the old saying goes, you can't pour from an empty cup. So part of the success that we see in existing school responder models are the educators and the school system being designed to support educators to focus on their wellness and self-care so they can better support students and show up at work with their whole selves and able to engage in that self-care and thus better do their jobs and support the students and be part of the school community. And the last guiding principle here is shifting cultures, which is really about creating school and community alignment around the goals that are most appropriate for supporting students with behavioral health conditions, again, with the end goal of keeping these students in school and out of the juvenile justice system. So when engaging in a behavioral health response, again, this would entail screening for behavioral health conditions. There are many different approaches that the schools we work with take in order to accomplish this. So the focus is on youth with behavioral health conditions, and depending on the capacity of the school, we'll have different schools that engage in universal screening. They screen all of the students in their schools for any risk factors, for any flags on these validated screening instruments. Others may screen only those with a number of identified risk factors that the implementation team at that school developed as part of their school responder model. If they identify youth with escalating behaviors that could lead to being arrested, maybe those would be the target population. If a youth in the school is about to be arrested, they'll flag on the spot there. Or if they have youth who've already had contact with the juvenile justice system, they may be the priority populations for screening. It really depends on the capacity of the school and the resources available at the school to do this work. So a school responder model is it's not intended to be another thing for the school and community to do, but to be integrated into the activities and initiatives already present in the school. So when doing this work, we don't dictate that a school has to engage in universal screening. Depending on the number of students and the ratio of staff to students, that may be too cumbersome or burdensome for schools to do. So when we're working with schools on developing their models, and we'll talk a little bit more, Avery will actually go through a flow chart of what one particular school responder model looks like on paper. When we're working with these schools to develop these, we think of what's the capacity, number of students, number of staff, what's reasonable to make sure that students who are at risk for referrals to the juvenile justice system get access to the behavioral health supports that they need. School responder models have been proven to be successful thus far. There's a lot more research needed on these models. They're not, we can't call them an evidence-based practice, but we do know based on the work that we've done, again, over the past decade, that there are a lot of successes associated with doing this work and a lot of ways in which schools have become safer places for students and for educators. So in Connecticut, they operate what's known as their School-Based Diversion Initiative, or SBDI. That's their school responder model. And the first chunk of data you'll see here is data that they shared with us from 2010 to 2018, where they saw a 34% reduction in court referrals. They were able to connect 47% more students to behavioral health services than they would have been able to connect without having this school responder model framework in place. And they have over 4,000 teachers and staff trained in how to recognize trauma and mental health concerns. So this is a great success, and Connecticut is often discussed in the context of school responder models for the great work that they are doing. And another state we've worked with in the past is Nevada, where they've had a 15% reduction where their school responder model is being implemented 50% reduction in referrals to probation. So again, keeping these students in school. And Schenectady High School, who we will hear from, has had some spectacular data come out of their work and their diversion initiative. So I won't even talk about it and save that for Andrea and Tim to dive into. So we know that there's been success with outcomes, and we've also had some great connections with these different states and communities implementing school responder models that can talk about not even just the outcomes, but the process of engaging in a school responder model. So the work that we're doing right now as part of the NIJ contract, the Comprehensive School Safety Initiative, involves work with 4 schools in Louisiana. And 3 out of these 4 schools are implementing circles as part of their regular practice for addressing student misbehavior. So if you think back to the graphic of how the school responder model is an alternative to the traditional school to justice pathway, engaging in that graduated response is a way to respond to student infractions. And we have 75% of the schools we're working with in Louisiana doing that regularly, which is a wonderful thing. As far as this not being a separate program, but instead a framework that schools can apply to work they're already doing. In one community in Wisconsin, we see this play out exactly as a great example of integration, where their Safe Schools, Healthy Students grant, PBIS, restorative practices, and the community partnerships they have, all these different existing resources align with the objectives of their school responder model and help them to implement and integrate their school responder model framework pretty effortlessly. So they're able to tie all these existing efforts together and engage in this alternative response without an extra burden on their staff. Through the NIJ project, we're also working with 4 schools in Michigan. And in one school, they reported that their participation at parent orientation increased from 10% to 20% from 2018 to 2019 to the 2019-2020 school year orientations. So while they would, of course, love to see that number continue to grow, that was an increase in parent engagement at orientation or family engagement orientation following their participation in a family engagement seminar that we held, giving them some tools and resources for them to create an action plan to improve engagement. And after just 1 year, they already saw the increase, and we're hopeful that the 2020 to 2021 school year will lead to some additional increases as well. So when we're talking about school safety and school responder models, it's important just to kind of recap a little bit here that school responder models have the potential to increase understanding of possible root causes of student misbehavior. Some of these misbehaviors may lead to school violence or may lead to risks to school safety. So again, school safety includes an environment where students and staff are free from bullying and things of that nature. And if a student is engaging in bullying, that may be the result of something happening in that student's life where they're engaging in bullying, maybe rather than being called into a school social worker's office to have a conversation about what's going on, that student may be suspended. But through proper assessments and subsequent clinical screening, schools can use school responder models to identify those students with untreated mental health conditions, substance use disorders, or trauma histories that may be responsible for some of these behavioral infractions in school, and keep them in school and out of the juvenile justice system. So when we conduct training on school responder model, we spend a lot of time talking with school staff on adolescent development and the impact of trauma. Traumatic stress reactions can include things like aggression, irritability, anger, inattention. These are things that school staff can be observing in students, and these may be perceived as problematic school behavior or arguably as different forms of violence. But when these students are screened through school responder models, the possible underlying causes, which may be mental health conditions, behavioral health, substance use disorders, trauma histories, can be identified. and that student can get referred to appropriate treatment and support. Again, keeping these students in school and creating safer environments for everyone. And I'll just quickly pause there and see, Avery, do you have anything that you'd like to add on what we've discussed so far on school responder models?
I do not. Thank you, Crystal.
I know Avery's probably muted. Thank you.
Yeah, no, I do not.
So I'm going to spend a little bit of time here talking about specifically this cross-systems collaboration piece, which I mentioned was a core component of a school responder model. And then we'll hear from the folks from Schenectady and all the great work that they're doing as well. So, let's see, slide. Okay, so when building a cross-systems collaborative team to address school safety, again, a core component of a school responder model, it's important for the collaborative team to include decision makers, people who can actually do the work, someone to coordinate this team. And it's so important for this team to have a shared vision of what a supportive ecosystem for students with behavioral health conditions can look like and what is possible. So it's really important in cross-systems collaborative team building for all of those involved to really have this shared vision of what it looks like to support students with behavioral health conditions, what does it look like to keep them in school, and what does it look like to keep them out of the juvenile justice system. And as far as who's actually on this cross-systems collaborative team, from the work that we've done in school responder models, we really recommend that obviously schools are on board, including the leadership of a school, those who are actually implementing this, whether that's teachers, school social workers, school psychologists, and so on. Having community law enforcement as part of the cross-systems collaborative team is huge, and we'll hear from Schenectady about some of the work that they do in this collaborative area. Community behavioral health, and again, this would be substance use services, mental health services, trauma support services, a comprehensive community behavioral health team to support students and their families. Community-based organizations that serve youth would be essential for this team. Looking at families and youth themselves, which we'll talk more about, and juvenile justice system partners, having a judge in support, for example. How does this team really have the key players necessary for the decision-making, for the actual doing of the school responder model implementation, and really having a coordinator to help drive all of this, and they all come together, create a shared vision for how to serve these students, these young adults with behavioral health conditions. So as far as students and their families, again, they should be a huge part of the cross-systems collaborative team in a school responder model. We know that school responder models are more likely to be successful when families are involved. And not only are the models more likely to be successful with the families involved, the youth buy-in, not just the family, but having the youth buy into the model helps promote success on a peer level as well. And involving the family can sometimes be a challenge. Again, we held a family engagement seminar for the schools that we're working with to try to give them some resources and tools for doing this effectively, because it is often noted as a challenge or a barrier in schools. However, there are strategies for increasing the likelihood of success, making sure that staff are trained in family engagement, making sure that outreach to families is linguistically and culturally relevant, and that there are investments and supports to address any barriers related to language and culture, offering whole family supports, not just focusing on the student, but looking at the full family unit and how that can be supported, and using peers to bridge the gap, using parent peers to bridge the gap, parents talking with parents rather than any power dynamics that may be involved with, say, a principal talking to a parent. There are opportunities, and there's a lot of, there's a lot of success that we've seen in the field when folks go this route and use the parent peers. So just to recap here, that the family engagement is such a big part of this cross-systems collaboration. We know that family engagement is essential in supporting students who've experienced trauma, We know that restorative practices create these opportunities for bringing families into the school, and higher rates of family engagement have been associated with decreased likelihood of suspension and fewer instances of violent behavior. So family engagement can also promote school safety and is essential to the success of a school responder model. So I'm going to hand this back over to Avery, who I just talked a lot, and what we're going to hear from now are, again, the folks from Schenectady who are actually doing this and can talk about what this looks like in an applied format. So Avery, I'll hand it back to you to lead that discussion.
Thank you, Crystal. Yes, we wanted to, kind of give some real-world discussion and opportunity for discussion in what this work looks like on the ground. And so we'll bring in a couple of other things from schools we work with, but we are fortunate to have fantastic partners right up the road from us here in New York, who are in Schenectady, New York. And Andrea and Tim and their colleagues in Schenectady School District and in the Schenectady kind of larger community are doing fabulous things with their school-based diversion initiative. So we call it the school responder model, and they call it the school-based diversion initiative, but they are, those terms are referring to some of the same practices and processes. So I won't steal anybody's thunder, and we'll just turn it over to Andrea and Tim.
Thank you for having Tim and I. We're thrilled to be here to discuss our cross-system collaboration. If you go to the next slide, I can talk with you a little bit about some of the things we've been doing in Schenectady. And to Crystal's point, there really needs to be a foundation around this work that's beyond just the responder model. So over the past several years, our district has been working toward an emphasis on creating a culture of care within our school district, which includes a very heavy focus around restorative practices and tackling a district-wide effort to implement trauma-sensitive schools. We've also revamped our code of conduct to be more reflective of these practices and address places where bias exists and lead to disproportionality. This also has entailed training of staff on restorative practices and threat assessment, improving our mental health supports. For example, we implemented a crisis prevention team within our district, which has us with our own psychiatric nurse practitioner on staff, and implementing our responder model, which is what we call the school-based diversion program. And as you'll see in a few minutes at the end of our presentation, these efforts are really paying off for us as we have seen suspensions and disproportionality reducing. On the next slide, we're going to go into some greater detail about our school-based diversion program.
This project was, I'm sorry.
Yep, go ahead, Tim.
This project was a state and local partnership. It was led by Department of Criminal Justice Services, Tom Andriola of the Office of Youth Justice, and included stakeholders from the Schenectady City School District, Office of Community Service, which is our local mental health department, Schenectady Probation, Schenectady Office of Children and Family Services, the Schenectady Police Department, and it also included a family court judge representing Schenectady County Family Court. The original intent of the program was to create an arrest diversion program, but it became a school-based diversion model with a focus on diverting youth with behavioral health needs from entering the juvenile justice system. And as Avery spoke about earlier, we prioritize cross-system collaboration and with a focus on common language in supporting our youth with evidence-based interventions in both the school and the community. Just this way we're all on the same page and not trying to have the same mission but going on a different path. This included introducing the youth assessment screening instrument, which is a probation screening and assessment tool that we use throughout New York State, and also the Massachusetts Youth Screening Instrument. And we introduced those into the Schenectady City School District. And with the partnership of the Office of Probation and Correctional Alternatives, we arranged for school staff to be trained in these tools and also arranged for them to become the first district in our state that had an agency account where they were actually able to use a lot of the tools probation uses at intake, which did require us to change some things like offenses because it's not really, JD or PINS focus. It's more school focus on the behavior and needs of the youth and within the school. We also partnered in trainings and sharing resources such as ART, DBT, restorative practices, spoken a lot about today, functional family therapy, and other evidence-based programs. And during the initial startup, many of the probation officers and other community agencies were trained in some of these models. So what we did is we supported the school district in providing that service and then partnering with them in delivering these services, and then pulled back and kind of just support them more in the community now. Our desired outcomes were we had both local and state outcomes and goals. They were to identify youth with behavioral health needs at the front end of the system, assess youth by expanding the use of the MAISY, divert school-based incidents to a newly developed system of care, and this would help decrease percentage of youth population referred to probation, family court, decrease percentage of youth receiving out-of-school suspensions, and decrease the average length of suspension. I mean, the goal is to keep them in school and provide them services in school. State goals included expanding capacity for services for youth, reducing racial and ethnic disparities that might be found in school-based referrals and arrests, have measurable outcomes, and to expand efforts statewide. The goal of this, and I think Albany started doing a model very similar to this last year, is to kind of expand this throughout New York State and the country.
So I'll give you sort of a brief overview of what the process looks like when you enter into diversion. So the diversion process starts when obviously a serious incident has occurred that would warrant a student to be brought normally to a superintendent's hearing. And as an alternative pathway, parents and students can choose to engage in the diversion process as opposed to entering into the superintendent's hearing. And so essentially, within 24 hours of the incident, we have a member of our pupil service staff, so typically our social workers or our counselors, whoever has the best relationship with the family, would reach out separately and have a conversation about what diversion looks like and the benefits to diversion around it being a more therapeutic process, something that would enable them to have access to evidence-based interventions and treatment planning, that it would help to identify the root cause of the behavior and repair any harm that's been done. And the reason we have a member of PPS do that as opposed to the administrator who's been the person dealing with the suspension is because a lot of times our families don't trust and they are upset and they get a lot of phone calls for behavior. So to have somebody that is more from a therapeutic realm to have that conversation, a lot of times the conversation goes a lot smoother. So if a parent agrees that, yes, my child and I agree, we want to pursue this therapeutic process as opposed to going to a superintendent's hearing, we schedule, they sign a waiver, which is viewed, it's like a plea of no contest with consent to initiate the intake process and engage in the assessments. And we have a school psychologist that's involved along the way to make sure that we're looking to see if it's a student with a potential disability, what's the is there any manifestation of a disability suspected or happening, and how does that play into the incident? And then we have the consent sent over to our diversion team who initiates an intake. We have 2 diversion specialists and a licensed mental health counselor who conduct the screenings and do treatment planning. And those were the 2 diversion specialists we added along the way as we saw our data showing the need for that. So the first year we were struggling. The kids that were having the least success with diversion were kids that didn't have their families at the table engaged through the whole process. So we added a family specialist to be able to help with that process and help bridge the gap and work with families through the process, especially when it came to helping them to get access and engage in their evidence-based treatments. And then we have our second diversion specialist who works a lot on the aftercare. So once a student returns back to school, making sure that they continue to follow up with the student, the family, and the team around their reentry planning to make sure that they don't become disconnected in that plan and then end up back on some kind of a hearing or an incident. So at the intake, all of those people sort of have a role in that. The diversion specialist works with the family and does part of the intake process. The licensed mental health counselor works with the student. They administer the MAISY, as Tim mentioned, and the MAISY, if we get a flag on the MAISY, it may indicate a need for an immediate screening. So that might be an immediate screening through our behavioral health center, our local mental health clinic, which we have agreements to elevate our students on diversion to an immediate appointment, I think usually within a week. So, or our own crisis prevention team. So a lot of times those flags get dealt with immediately, and a referral is made right away. And then what's called an ERT, an emergency response team meeting, gets scheduled. All along the way, we've got the students starting on tutoring, so they're engaged in their schoolwork. And then the ERT meets to take a look at what are the things that we now know through the MAISY. And also, if they don't flag on the MAISY, we administer the YASI, which Tim mentioned. So the ERT is really important. The members of the ERT include the family, the student, and the homeschool team. So the social worker or counselor, psychologist, principal, parent advocate, and the diversion team, and any community supports they might have in place. And the messaging around the ERT of we want you back to school as soon as possible, and as soon as we can figure out what the root cause is that's caused this thing and that you're safe enough to return to school, that messaging is really important, because we find that, the initial coming together at that table is a little unnerving for students, but to see their principal and their team wrapped around them to say, we're glad to see you're engaging in this process and we want to get you back as soon as possible is very powerful. We have a series of evidence-based interventions that we can prescribe. They range from aggressive replacement training, dialectical behavioral therapy, family functional therapy. We have strengthening families on our list of evidence-based interventions, restorative practices, substance abuse treatment, teen intervene, and trauma-focused cognitive behavioral therapy. And along the way, we've developed a sort of matrix that also helps us to tap into other resources that we think are just going to be good supports for the student. So a lot of times students' treatment plans entail a couple of evidence-based interventions based on their MAISY and YASI assessment, but we also add in some component of restorative practices on every treatment plan. So interactive journaling is one example of something that we use a lot to help students work through like what got them there. And so along the way, a lot of times students do end up suspended for at least a little bit while we make sure that they've stabilized and that we start addressing whatever the root cause is, but the ERT reconvenes along the way. And as the team feels a student is making progress, attending their therapy sessions, engaging in whatever evidence-based treatment has been prescribed in this diagnostic and prescriptive process, they can make the decision to advocate to get the student back to school sooner on what's called an abeyance. And so most of the time the suspension is cut down significantly. And then, as I said before, the treatment planning for aftercare is just as important in making sure that students go back into school with a really solid reentry plan, and that people are following up to make sure that that plan stays intact. If you scroll to the next slide, you'll see some of our data. Our overall number of suspension days were reduced from 2016 to 2019 by 36% at the elementary level, 31% at the middle school level, and 18% at the high school level. And we also found that students who completed diversion versus those who went to a superintendent's hearing significantly reduced their chances of dropping out of school in some of our data. And the one that's on the screen also will show you that from 16-17 to the end of the 18-19 school year, we had about a 45% reduction in overall district superintendent hearing requests. And I think Tim has some data he wanted to share around JD and PINS.
So our data also supports the impact of this model. Since 2016, our PINS intakes have decreased by 34%, with the largest being 37% of parental PINS. In the past, a lot of parents would be referred to probation to file pins on their youth. And now with this new model in effect, they're able to handle a lot of the pins or support the families within the school setting, and they're able to just really either deliver the service or refer to the service themselves. And our JDs have also decreased by 49.6% since 2016. I'm not saying that all of that is impacted by this program, but it definitely has contributed. And some of the offenses that we've seen a reduction in that traditionally would be offenses that we've seen a higher percentage from the school district would be JD offenses such as criminal mischief, criminal trespass. If a kid's coming after hours when they're suspended in the past, they would be arrested sometimes for that. That doesn't happen anymore. Larcenies, harassments. So instead of calling the police and having those handled legally and putting them at risk of being put in the juvenile justice system, the school has a system, and it has supports from like DSS, mental health, probation, to plan and program for that youth and their family within the school setting and the community. Some of the barriers, initial barriers or challenges that we've had was the training and building capacity for the clinicians, data sharing between agencies, that was kind of difficult in the beginning, process flow obstacles, limitations of some of the interventions as far as hours, transportation, building an effective and consistent emergency response team, which is solid now. And our initial goal, that is something we still strive to work towards in the future, is really implementing a program in the community that would help divert after-hours arrests for Schenectady City school youth. And that was our initial plan, and we'd like to get back there, and referring some of the kids that go to the district, if they get arrested after an hour, ones that are appropriate, we could maybe refer back to this program the next school day, kind of like how if a youth gets arrested, they come into probation for an intake, where they would almost come back to the school, those that are deemed appropriate, for an intake and supportive services within the school setting with the support of probation and other community agencies. And that's all I have to say.
We'll stick around at the end for questions.
Awesome. Thank you, Andrea and Tim, for that. I think it's kind of this, seems like a complicated process, but also just the outcomes that are possible are so powerful. So thank you for that, and I hope folks will take the time to ask you really thoughtful questions about what you all have been able to accomplish. So I want to make one correction to something I said earlier before I move on to the next slide. So as I was going through the numbers on school violence incidents, somehow the number 42 was the active shooting incidents that I listed between 2001 and 2018. That number is incorrect. It's actually 277, according to the FBI data. So thank you to the person who caught that discrepancy. So I want to spend just a couple of minutes just with a couple of other brief examples of how states have operationalized their school-based diversion initiatives or school responder models, just so you can see some of the products that have come out of the work. So, for instance, we have in front of you now the Minnesota Model Manual. So this is what the state of Minnesota has released to codify and clarify their school responder model or school-based diversion process for stakeholders, including, school personnel, community personnel, police, and students and families, so that everyone understands how the school-based diversion initiative works, what the processes are, and data collection and evaluation, so that this is not just a static thing that you do one time. It's actually a framework, and to understand what's working and what's happening with your students and families, there has to be this continual process of looking at the impact of what you're doing and the outcomes versus what you want to be happening. So that's what Minnesota has. And then we have a sample flow chart from the school that we are working with in Louisiana, Renew Accelerated High School, which is just outside of New Orleans. And so if this is hard to read on the screen, If you would like to see the actual flowchart, please feel free to email me. My email address will be up on one of the last slides we have. But their school responder model chart, as you know, Andrea walked through the Schenectady one, really clarifies that, you know, this is a framework that schools and districts or states are using to really localize and personalize what their school responder model looks like. So there is no one size fits all. It's really about what the local community or what the state is trying to do to provide behavioral health support. So in the Renew Accelerated version, you have kind of preventive efforts and responsive efforts. So on the left-hand side, you know, it talks about their universal screening process. They use the SABRS, the social and academic and emotional behavioral risk screen. They have restorative practices interventions. So these things all happen pre-infraction, trying to stem a problem before and respond to something that may bubble up eventually into the need for some larger or more intense responses. And then on the right-hand side, they have responsive efforts. So if, you know, a young person commits a certain number of infractions within a time frame, you know, 3 behavior infractions within 2 weeks or 5 behavioral interventions within 1 semester, that triggers screening. And then there's behavior intervention tracking that the teachers and staff can help school leaders identify if a student is displaying behaviors that may seem out of the norm for that young person and may indicate that something is wrong, or at least something could use addressing for them. And so the results that they've seen have been really impressive in the few years that they have been implementing. They've seen significant decreases in suspensions. So in 2016-2017 school year, they had 162 suspensions. You know, 3 years later in 2019, that number was down to 121, which was a 25% decrease. In that same time frame, the number of suspension days the students were out of school decreased from 414 to 354. Their annual number of infractions decreased from 120 to 81. And those high-level interventions like restorative circles that they were doing with students who committed serious infractions decreased actually from 103 in 2017 to 2016, or 2016 to 2017, to just 8 in the 2018-2019 school year. And they attribute a lot of this to their ability to be very responsive early on, and to have all their staff really being restorative in mindset and using restorative conversations, and being able to not have to go to that upper level where they have to have those like really intense conferences. So that is what we have for kind of the operational side of it. And so I want to turn it over back to Eunice to lead us through the rest.
Hi, everyone. Allison. Hi. Thank you so much, and thank you to all of our panelists today. This was such a fascinating discussion, and we appreciate all of your participation. So we've had a lot of questions and a lot of content to cover, so we just have really a couple of minutes to answer questions for now, but we still encourage you to continue to chat in your questions in the Q&A box, and then we can make sure to, Eunice, I'll ask you to probably flip directly to the contact information slides so that folks can make sure to get our contact information as well. So let's just get right to it then. At least we can have the chance to answer a couple of questions live. So one of the first questions that has come in is that there was a question about the school responder model and whether it's ever been implemented with any American Indian Alaska Native groups. And I guess, you know, within a larger question too of bringing a level of cultural competence to the school responder model, any suggestions or tips or strategies that you might offer?
That is a great question. So the school responder models are implemented all around the country. At NCYOJ, we've done work with select number of states and select number of schools to do this work. We just recently got a call from someone in the state saying they've been doing it. It doesn't require our participation to do it. So to be able to answer and say across the country, is this happening with particular cultural groups? That's an answer I don't know off the top of my head, but all these principles would translate. When we held our family engagement seminar, we had a national expert on family engagement who identifies as someone who is First Nation, Native American, working with the schools on how to do this work and do it well. At Policy Research Associates, we have tools that we've developed for taking existing practices and modifying them culturally. So if folks want to contact me, this is Crystal, I'd be happy to share that information of how to take something that's kind of standard and customize it for different cultures. We have some webinars on it, some tools on it, so we would be happy to share that.
Great, thank you so much. That's very helpful. And trying to collapse some questions so at least we can cover maybe one or two more quickly for now. But several attendees have mentioned this idea of information sharing and communication between the school providers and juvenile justice programs and even family members. So is there a policy, or are you all using MOUs to facilitate this sort of communication, or just any information you all could offer on that topic?
I'd like to actually, Andrea, do you want to share a little bit about how Schenectady navigates that?
Sure. I would say that in general, we use consent. You know, whenever we're going to have the student involved in both systems, we have a consent form signed by the parent. We have been, though, more recently looking into an MOU and some of the things that we might need to do to facilitate better communication around some of the more global things that we'd like to be able to talk about.
Thank you. And I'll add, for the school responder model, NCYOJ has an online toolkit for the schools that we're working with now to access different resources. The toolkit is undergoing a complete overhaul right now, so it's not available. But once the link is, I'd be happy to share it with anyone that emails us. And there are sample MOUs available, sample documents that can help folks see how other states or school districts navigate exactly what that question was about. There was also a question I saw come in about screening tools that are used. There will be a document on that website. I can also email it out to folks. Like they mentioned in Schenectady, they're using the Maisie. We work with schools that use the Gain SS, the Sabers, and we have, and a number of other ones. So we have a behavioral health screening tools for children. It's important to point out that these are non-clinical tools. Teachers can use them, and then they would lead to a clinical assessment from a clinical professional should a student flag on them. So just to answer another question in there.
Great, thank you so much. And several attendees have also mentioned, and this is not an easy question, I know to answer, but several attendees, and I think this will probably be the last question we have time for today, but several attendees have mentioned the challenge they face in their states or in their jurisdiction in terms of gaps in behavioral health services for youth that are available, and even challenges around Medicaid or other health insurance coverage. I don't know if even briefly you can suggest other resources or strategies that might be helpful in this regard. I know that's a large question.
Avery, do you want to add anything there before I say anything?
It's so variable by state. So, you know, you work with some states where, you know, there is not a lot versus other states where they are able to tap into a lot more through their systems of care and kind of through wraparound approaches. So I think it's really about kind of doing an intensive exploration of what is available, and a lot of that involves like cross-systems conversations to see are there ways that you can, you know, tweak access points for kids and systems if something's only available to justice involved youth or child welfare involved youth. Like, are there ways that there are programs available that you can increase that access? That's what I would add.
Yeah, thank you for that. And to your point, Allison, that is a big question to answer in just a few seconds. So again, I would encourage folks to feel free to email us, and we apologize that we didn't have more time for Q&A. But if you reach out to any one of us on the line, we'd be happy to share as much information as possible. And again, there will be some variables that are maybe state-specific, community-specific, but we can share some of what the communities that we have worked with, what they've done.
Great. Thank you so much. That's very helpful, and we really appreciate, first of all, thank you again to all of our panelists today and also to all the attendees. We had lots of questions, great interaction, and it just made the training even more interactive and exciting. So thank you to everyone today. We really appreciate your participation and hope you all have a good day and stay safe. Thank you. Bye-bye.